If a kid wheezes, is not well controlled, and allegedly taking the correct medication at the right dosages, when do you go to the next level to say, maybe there's something else going on here, and maybe it's not asthma or something that's complicating asthma, and they get involved with someone like you? What would be the triggers to a doctor to say, I need to do something more than I'm doing now?
I think you mentioned some of them already. If you have a patient who has wheezing or other respiratory symptoms that are attributed to asthma, and they're on very good medications, they know how to use the medications, and they're using them on a regular basis, and they're not responding well to medications, then I think that already that's something that you have to keep a high level of suspicion that there could be something else going on. And there are a variety of different things that can be going on.
What would be the most common treatable things that you would find in your specialty that were labeled asthma, but turned out to be something else? What would be the things you'd be looking for?
Well, there are some children who actually do have asthma that could be of a different inflammatory phenotype. These are some of the things that are actually coming out right now that may not be responsive to traditional inhaled steroids, for example. And this is something actually very, very difficult to explain, because some of the work that we've been doing over the past several years suggests that there could be chronic or latent infections that are contributing to poorly controlled symptoms. I don't want to get into that too much right now.
Well, would you be looking at things like cystic fibrosis?
Cystic fibrosis is something that we always look for in somebody with poorly controlled symptoms, and that's a test that we can easily, and that's a disease we can easily test for with a very simple and painless test.
And also, there could be things that are blocking the airflow, which could be a tumor of some sort.
Yes, those we do look for large airway abnormalities. I wouldn't go so far as to say that those are very common, but those are things that we certainly look for.
But if your kid's not doing well, it's an old expression.
Mm-hmm.
First you look, if you hear hoofbeats, it's horses, then it's zebras. Sometimes you look for the zebras.
Absolutely, absolutely.